Hello, everyone. My name is Christian Brooks. I am the Associate for Domestic Issues for the Presbyterian Church USA Office of Public Witness, and welcome to our first session of COVID at the Margins. COVID at the Margins is a discussion series by the Presbyterian Church USA, where we will be talking to grassroots faith and community leaders about how COVID-19 has been impacting their communities and how Presbyterians can get involved. This series will specifically focus on the different effects of COVID-19 on people of color. So we have all been seeing all of the data and statistics that have been coming out about how COVID-19 has been disproportionately impacting people of color. However, we know that data and statistics only paint a small piece of the picture. So this webinar series is intended to paint a more detailed picture of what is actually going on the ground. So today's session will focus specifically on the Black community. We have two phenomenal women who will be a part of today's discussion. Reverend Roslyn Bouier, who is the Executive Director of the Brightmoor Connections Food Pantry in Detroit, Michigan, and Rachel Olliverre, who is a recent graduate of Carnegie Mellon University Hines College with a master's degree in healthcare policy and management. She conducts research on underserved populations and is an outspoken advocate for Black immigrants in the Northeast. But before we get started with our discussion, I will hand it over to Reverend Jimmy Hawkins, who is the Director of our Office of Public Witness, to lead us in a biblical reflection.
Thank you, Christian. I'm going to share my screen. All right, can everyone see the screen?
Yes.
All right. So we're going to talk about COVID at the Margins, a Bible study focusing in on Leviticus 19. Let me go ahead and make that widescreen. All right, as we look at this passage of scripture, Leviticus 19, verse 15, it reads, "You shall not render an unjust judgment. You shall not be partial to the poor or defer to the great. With justice you shall judge your neighbor." We know that the word partial means that you are impartial, that you are not impartial, that you are showing favoritism towards certain groups. And the Bible has this message consistently throughout. From Deuteronomy to 1 Timothy, the Bible says, "You shall not be partial in judgment." To show partiality is not good, that God shows no partiality. We are to be people who are of justice and to treat people fairly. And so as we examine this passage of scripture, I want you to think about three terms. One, systemic racism. Obviously, racism is race prejudice plus social and institutional power. It's a system of advantage based on race, a system of oppression based on race, and a white supremacy system. Also think about the term colorism, because as we deal with the issue of race in the United States, around the world, not only does your race impact how people treat you, but also your color. That the darker you are, chances are the more oppression, more discrimination you're going to have to face. We see this in these examples around the screen, top left, O.J. Simpson's mugshot, but we see how both Newsweek and Time in particular darken his skin to make him appear more sinister. We have this Dove commercial on the left where an African-American woman is taking off a brown t-shirt, and then when the t-shirt is taken completely off, it reveals a white woman. And the commercial said basically she was now clean, she was now pure. The issue of colorism also impacts different racial communities. We see that in African-American communities, that to appear to be whiter oftentimes enhances your career. And we see celebrities who have lightened their skin. Then also we deal with the issue, I went backwards, implicit bias, which is really a topic of discussion nowadays, where in particular young people are sharing the bias that they have been faced with, where people want to touch their hair. The young African-American, and these are statements that each one of these have heard. The young African-American man says that you don't act like a normal Black person. The Latina has heard, "You don't speak Spanish," and the young lady on the right, "No, where are you really from?" Implicit bias is when you make judgments or you have stereotypes about people based upon their appearance, and oftentimes you're not even aware. So look, if we look at two very brief passages, Numbers 12-1, and I want to show some implicit bias and even elements of racism that a commentary has posted online. Numbers 12:1 reads, Miriam and Aaron spoke against Moses because of the Cushite Ethiopian woman whom he had married. For he had indeed married a Cushite Ethiopian woman. Now this commentary said on, it's called Enduring Word. It's online right now for Numbers 12:1. He says, well, they criticized Moses because of the Ethiopian woman, because of her dark complexion. And then in the orange, it says he had married an Ethiopian woman, and her appearance, either because she was an Ethiopian, meaning a Negro, or had a dark complexion as an Ethiopian. This commentary is so blatantly objectable and offensive, because he is basically interjecting his own feelings, his own implicit bias about people of color into the passage. It really had nothing to do with her complexion. As a matter of fact, in antiquity, people didn't care about your complexion. They were more concerned about your nationality, your religion, whether you were part of their tribe or ethnic group, but they didn't care whether you were dark or light. They didn't deal with people the way we do today. And then the second passage from Song of Solomon, which reads, I am black and beautiful, O daughters of Jerusalem, like the tents of Kedar, like the curtains of Solomon. Do not gaze at me because I am dark, because the sun has gazed on me. This is what he says. He says, I am dark but lovely, which is his first mistake, because the word is not but, the word is translated as and. And then he says that she had self-doubt, that she felt she was unattractive and unworthy. And he's basically interjecting his own reading, changing what the meaning of the passage is. And this is basically reiterating the same thing, that that fair skin was considered more attractive than tan skin. Now, when you look at the Hebrew, it says, I am black and beautiful. And you see the Hebrew words in the middle, wherein you have the V with the symbol there. And the letter Vav, which is the letter on the right, is translated as and. So basically, I showed you this to say that this woman had no inhibitions. She said, I am black and beautiful. I am dark and lovely. And she was proud of how she looked, and she was presenting herself to her lover. And again, this commentator, what he is saying, he mistranslated the verse. And interestingly enough, most of the translations of the Bible say dark but lovely. But the actual translation, according to the New Revised Standard Version, the Contemporary English Version, about 5 others, dark and beautiful. So how does this impact us today? We know that implicit bias is everywhere. The weekend of the 4th of May in New York City, they sent policemen out throughout the city to make sure that people were complying with the regulations, staying social distancing, physical distancing, and also to wear masks. They were heavy-handed in Harlem. So the picture on your right is a policeman sitting on the head of a young African-American male. And when you watch the video, the policeman was the aggressor. He went over, he slapped the young man, dragged him to the ground, and they handcuffed him. Now on the left, this is West Village in New York, the same city where the policemen are not out in force, they're not over-policing, and these people are not, none of them are wearing masks. And basically what the police did was they went throughout the community and they passed out masks to those who were there. And then we know that disparities throughout this country exist. And these are things that you all are aware of. But one of the ones that I do want to highlight is this third paragraph that says that one study found that Black patients with diabetes did worse than white patients, even when they had the same doctor. So disparities are everywhere throughout this country, and they are complicating what's happening with COVID-19. That Black and brown people who are not the majority in many populations and yet disproportionately are impacted. And we see 40% of COVID-19 deaths in Michigan, 14% of the death of the state's population. So I close to say this. We're called to be people of the greatest commandment, wherein Jesus said, you shall love the Lord your God with all of your heart, with all of your soul, and with all of your mind, and you shall love your neighbor as yourself. And he redefined who is our neighbors. Our neighbors are the ones upon whom we are to show mercy, to have compassion, and to have love. And so this is the time we're in. This webinar is really needed, and I look forward to hearing from everyone who is participating. Thank you.
Thank you so much for that, Reverend Hawkins, for really laying the foundation for this discussion and setting us up in talking about systemic racism, because we know that the reason why the Black community, in particularly, is seeing all these devastating impacts of COVID-19 is because of systemic racism in all aspects of our system, the interpersonal aspect of systemic racism, whereas we have doctors who are not meeting the needs of their patients, not paying attention to the needs of their patients, environmental racism, where we have large factories being located in Black neighborhoods, polluting toxics into the air, water, and ground, causing these pre-existing conditions, right? So I will pass it over to our two guests to tell us what's going on in your community, and really how has systemic racism contributed to the devastating effects of COVID-19 on the Black community. And I will pass that over to you first, Reverend Roslyn.
Thank you. Thank you for having me on. And I want to say that I've enjoyed what I've heard thus far. And it's rightfully so. It's been right on point. In our community, Brightmoor Connection is located in the northwest section of Detroit. It sits in the farthest section, and it has the highest population of water shutoffs, the highest population of infant mortality deaths in the womb and out of the womb. Brightmoor Connection also has the unique distinction of excuse me, having one of the highest populations where Child Protective Services has come out immediately and taking children. Brightmoor Connection also has a water station. And what we do with the water station is we supply families who are forced to exist without water. The water station, we advocate because we know policy makes a difference. Policy is what shifts and directs the future outcome to, excuse me, to unburden us from these unjust systems, right? But we know that also we need to give water as a stopgap in that moment. And because of that, we have a water station where families are allowed to come and pick up water to meet their emergent need in that moment. We also fight for, and we've always fought for water, housing, for one fair wage. We fought against the oppressive nature of not having earned paid sick time. If we had more earned paid sick time, we would not see the numbers as high as we're seeing presently in Detroit, moreover in Wayne County, because folks do not have the ability to go to doctors, just as you stated. Community benefits is a big fight that we've always maintained. So all of these are wrapped around systemic racism. We know that they've been here, they've been percolating, but now with COVID-19, we've seen an overflow of a boiling pot, right? We know that in Michigan, with 14% Black population statewide, but 33% of the infected population are Black, the Black community. 41% of the COVID-19 infections and deaths are with Black people. But we need to address the fact that 80% of those deaths are in Detroit and Wayne County. And we need to look at why. And the reason being goes back to what I just shared. Because of the main oppressors that we've been fighting against. One fair wage. Families are not making a fair enough wage to be able to do and pay the utility bills. Also, we need to address the fact that without water, we know that families would not be able to wash hands. So when we see what's happening on the ground, the systemic racism that's always been here, long before COVID-19. Water shutoffs have been going on since 2014. Housing issues have been going on, right? We know that community benefits, one fair wage, earned paid sick time, all of these are oppressive, systemic racist systems that have continued prior to COVID-19. But now once COVID-19 comes into play, we see it exacerbated. And so that's what we're seeing happening in the city right now, going on in our community. What we continue to see also, sadly, is that the lack of addressing the needs of Blacks in community, right? It's always the narrative that we need to disrupt. There's never not a time that we have to go back and challenge the narrative. Just as with the text, we go back and challenge what the text says. My discipline, excuse me, is a New Testament biblical scholar, but also as a womanist interpreter. And as a womanist interpreter, we look at the whole community. We look to seek to make the community as a whole healthy and have a well-being. And that's not what we're seeing in Detroit right now on the grounds. And I know you have some more questions from you, but needed to share that with in Brightmoor, with the highest population of infant mortality deaths and the highest population of child protective services coming out. That says we need to look at where does the issue originate from, right? Where is this stemming from? And so that always goes back to the land, and it always goes back to labor. The land being because the water issue is the byproduct of getting the land from folks, moving and displacing Black bodies from ownership of land. The labor piece comes in because children are removed from the home when the water is shut off. We know that 80% of the water population shutoffs is Black women with children. That tells us that the goal is to remove children, placing them in the in the foster care system. And that we know systemically, children who end up in foster care have a higher percentage of ending up in the penal system. So we see the long-term implications. We see the long-term damage that's done in our communities. But once again, what we're seeing right now with COVID-19, as horrific and as insidious as COVID-19 is ravaging the Black community, we need to understand why it has such a lead in the Black community. And as you pointed out, it stems from the healthcare, it stems from our services, the lack of services, the inequitable and unjust transfer of services in our community. Yes.
Thank you so much. Thank you so much for that, Reverend Roslyn. And we'll come back to a couple things that you said in a moment, but I want to pass it over to you now, Rachel. So just tell us about what's going on in your community and how systemic racism has contributed to the devastating effects of COVID-19 on the Black community.
Thank you. Thank you, Christian. So I am here located in New Jersey, right next to a community that's really a lot of immigrants, you know. So I'm going to be speaking strictly about the community, the Black immigrants, the Afro-Latino immigrants that I see here in my community. And what I see a lot, especially when it comes to systemic racism, you know, it has impacted our communities in multiple ways. But what I really want to focus on is the poverty. Like, you know, there's a lot of poverty that comes, unfortunately, with being Black in America. And I think that this issue is really exacerbated when you're an immigrant. You know, we talk about when you want to look for a job, if you want to find a job, if you have a non-traditional name, like an ethnic name, you're less likely to find a job. So if you think about like the West African immigrants, we think about Afro-Latinos, people who don't have traditional names, they cannot find a good paying job. They're typically relegated to these blue collar, low paying positions. And what that does is it basically puts you in a position where you're not living, you know, you're not living well. You're living in very cramped locations. Typically we see people, multiple families living in one small apartment. Thinking about my own experience growing up as a child. If you're an immigrant, you typically have multiple families living in a homes. Most of these people are essential workers. So, you know, if you have your family, your mom and dad work in a Walmart, maybe you have another family member, cousins, or aunts who work in hospitals, you're all coming back into the same cramped apartment in New York City, in the Bronx, in New Jersey, and you're basically allowing this virus to spread. And a lot of that has to do with the fact that we typically exclude immigrants from certain job opportunities. If you have an accent, people think that you're not as intelligent. We use that as a way as an indication of how smart you are, simply because you don't pronounce words the traditional way. So that excludes you for job opportunities. We think about applying for schools. You are less likely to be able to go to school and pursue better opportunities simply because you sound different. You do not understand the system. So, you know, when we talk about poverty, we talk a lot about the essential workers here. If you are an essential worker in New York City or in New Jersey, where I'm located, you have to take public transportation. It is extremely expensive for you to own a car and to pay rent. Rent, you know, we talk a lot about the Northeast. The cost of living in the Northeast is extremely high. So you're less likely to have a car. You have to take public transportation. everyone is on public transportation. That includes the MTA workers, the janitors, security guards, the nurses. We also have a big issue in New York City where they have a large homeless population on the subways. And what that does is basically it just puts you at risk. So unfortunately, you know, in our communities, we don't have as much space and leeway to move around simply because of where we're located. Most immigrant communities are in the Northeast. They're typically a lot crowded. There's very little space for you to move around. And then of course, because you're an immigrant, you don't have that family connection to say, okay, well, I'm going to go and stay with family in another part of the country. We don't have that. We're all located in this one community. And that really exacerbates a lot of the issues. If you were to go to the Bronx, I was in the Bronx recently, there were people outside who had to go to the laundromat. There are people who are cashing checks. There are people who are sending money via Western unions to their families back home. We don't have the luxury to really, you know, sit at home and shelter in place. That's not an option for Black immigrants, because unfortunately, the choices often are you can feed yourself, you can feed your family, pay your rent and take care of your kids, or you can put yourself at risk for a virus. And that's really the situations that we're seeing. We're really seeing the impact of how systemic racism has really helped to exacerbate a lot of the issues that I mentioned, but also that Reverend Roslyn mentioned as well as going on in Detroit. These issues have always been here, she said, but these issues now, because of this virus, they're just simply exacerbated. And we're really shining a light on some of the things that we're seeing in these communities.
Thank you for that. Thank you for that, Rachel. And that is a great lay of the land, because I don't think that we always think about the fact that, one, with immigrant populations, either there are multiple families in one household, or your family is in another country. So like you said, you can't move around. You can't, oh, well, I'm just going to go stay with my family in Texas until this blows over, or whatever the case may be. You don't have that option. Also, just the fact of the essential services that you still need to take advantage of, like going to the laundromat, cashing a check, going to the grocery store. I think we take for granted the amount of Black immigrants or Black people in general who are unbanked. So people are going to the check cashing place because that's how they pay their bills. But passing it back off to Reverend Roslyn. So you've been mentioning water shutoffs, and we know that this has been a big issue in Detroit for a while now. You mentioned since 2014. So we may have some people who are viewing who aren't aware of the situation with the water shutoffs. So can you tell us more about that and how it is affecting the community during this pandemic?
Yes, thank you. So, and as Reverend Rachel just mentioned, I need to say that in Brightmoor, there is the issue, most especially where the laundromats were closed. Brightmoor, being a community that has the highest population of water shutoffs, the one laundromat that was in community was closed down for a farmer's market. And so we need to, I just want to lay the framework of what's happening with the water shutoffs. Water is shut off in the city of Detroit and the state of Michigan when, quote unquote, your water bill is behind, right? The water bill can be placed onto your property taxes. And so that's why about 8 weeks ago, the news cycle was spinning around the over $600 million that was over assessed property taxes and illegal home foreclosures. And that was due to the illegal water shutoffs and the exuberant water bills. In Michigan, you get a water bill, and it's including the water bill, the drainage bill, and the sewage bill. And so usually those three bills, I'm sorry, I did not take care of this as I should have. Usually those three bills, I apologize. Usually those three bills can range anywhere from $150 to $300 a month. And so yes, a month. And so what happens is we'll see legacy of water bills. And so what that means is that most folks will be placed onto a payment plan. And the payment may be $50 a month, but that remaining $250 goes into a constant accruing bill, which goes onto your credit record. But by the end of 4 months, you already had $1,000. So most people are forced to live without water because the state, DWSD, Detroit Water and Sewage Department, shuts your water off for, they'll say, as low as $1,000. What we've seen, and we have documentation to prove that they've shut it off for as low as 10 cents. And so once the water is shut off, you have to pay a disconnection fee, a reconnection fee, and all of the arrearages for that water to be restored. So that can go into anywhere between $1,000. In the pantry, we've been raising funds, and we've been paying water bills for water restoration and to prevent shutoffs, because water is still being shut off in the city of Detroit. Contrary to what you're seeing on the news, the governor declared a moratorium. It has not been enforced. The city of Detroit, the mayor's office has not enforced it, and so we're still having water shut off, which means that someone is forced to exist without running water in the home. And I need to paint a picture for you. I need your viewers to see what I see every day, okay? So we know that COVID-19 lives. We know that medically they've proven that it lives in human fecal waste for up to 14 days. Well, as Ms. Rachel said, then in most communities of color and Black communities, we have households where there's 2 and 3 generations in the home. And we're seeing households where families are forced to live in their homes without running water on. Now, during normal times, well, excuse me, what we call normal times, because normal really wasn't that well at all, if we be honest about it. But prior to COVID-19, folks went to work, they went to school every day. So they had the ability to use the restrooms, to wash their hands, to wash up while they were out. And that's been removed because of the quote unquote shelter in place, which, as Rachel so adequately pointed out, shelter in place is not that term is not used correctly either. Shelter is defined as a place of stability, a place of protection, a place of comfort. None of that applies with sheltering in when you don't have water on. So for families whose water is shut off, the waste has to be taken out to the garbage. And the human COVID-19 lives on in human fecal matter for up to 14 days. So that's why we see the high population in Detroit of deaths due to COVID-19. It was already here. About 2 years ago, the hepatitis A outbreak was going on in Detroit and Wayne County. Yes, and at that time, the city they forced the sanitation workers to take a hepatitis A shot because of the high population of outbreak of hepatitis A, which is due to not being able to wash your hands, once again, and it creates a public health crisis. We went to the governor at that time. We've gone to the governor on numerous occasions. When I say we, I mean, I'm speaking about collaborative organizations such as Detroit People's Platform, their Aunt Linda Campbell, We the People, the ACLU. We've wrote letters, we've done petitions. We've done all of our due diligence to get this addressed because folks are being forced to exist without water. And as I said to you, the highest population of water shutoffs is Black women with children. And we need to look at that because what happens is historically, the families are put onto a payment system, right? So that means the water department is already aware of what that Black mother can pay in her, her monthly bills. So what we're seeing is economic profiling. We're seeing systemic oppressive racism at its rawest form because you've turned off water for women with children in a home, knowing that they cannot afford cannot afford to pay the disconnection fee, the reconnection fee, and the arrearages, which is all what's needed to get that water turned back on. The city of Detroit Water and Sewage Department, through their own admission, has said that they've dropped people off the rolls because once the water's been off longer than 6 months to a year, they don't keep their information in the system. So that tells me you knew they could not afford to get the water turned back on when you dropped them off your rolls because you knew economically, because they were already on a payment system, they could not afford to pay that disconnection fee, reconnection fee, and those arrearages. We see this even more exacerbated during COVID-19 because, once again, in Black communities, people are not sheltering in. They're not able to stay home. People are still working. They're having to move about. As I started out sharing about the laundromat story, Brightmoor has the highest population of water shutoffs, and it had one laundromat. The laundromat was closed because of a farmer's market. Now, while Brightmoor also sits in a food desert, and there's definitely a need for fresh produce because we know fresh produce and fresh vegetables definitely assist in our health and well-being with high blood pressure and diabetes. But if it's an area where there's no access to running water, fresh vegetables won't help you. So that told me, and that tells you, The laundromat was closed and the farmer's market was open, not for the people who are here, but for the ones who are coming. So it's this constant displacement, right? We're constantly seeing Black bodies being displaced from homes, from places of safety, from places where water is available. We've been fighting for the water affordability plan since before 2014 when water shutoff started. And that's based on, it's income driven. It's based on the income of each individual. We've had so much pushback and we have not been able to get that pushed through. But the thing of it is that we know policy changes things, right? And so systemic racism, structural racism is all based on policies that have not been changed, addressed, or for lack of a better statement of saying, it's just called out for what the insidious nature of what they are and what they do in our communities. And so the running water piece of not having running water in the home, families come to the pantry and they'll get about 15 to 20 cases of water. Right now we have 14 pallets of water in the pantry. On each pallet is 78 to 80 cases of individual water. So for each family that comes without water running in their homes, we'll give them 15 to 20 cases, but that does nothing in respect of what they need that water for. That water has to be used to make baby bottles. So you have to make a decision if you're going to use 1 case of water for a baby to make baby bottles for the next couple of days, or if you're going to use that to wash the baby up with. So those are the kind of decisions that folks are having to juggle with in the Black community. And along with trying to deal with the fact that COVID-19 is running through this community rapidly, and that's through all of Detroit and Wayne County, where there's 80% population of death and infection going on. I hope that helped to explain it some.
Yeah, it definitely did. And thank you so much for that explanation, Reverend Roslyn. And thank you so much for painting that picture, because I don't think we're always aware of what is going on the ground, and the fact that, you know, right now we are in a pandemic where the one of the only ways to fight against it is to simply wash your hands, or one of the ways to nurse yourself back to health is stay hydrated, and people's water as being disconnected is pretty absurd. So thank you so much for painting a picture and letting us know that. And
can I share this?
Mm-hmm.
Thank you. Something I want to share about the laundromat issue. Immediately when the governor declared a moratorium on shutting the water off, and the city decided not to follow through with that, the next thing the mayor did was they closed the laundromats. So now not only are you barring people from having water in their home, you are in effect just deciding that they can no longer have sanitization as well, because closing the laundromats, the one resource that was available to at least bring some type of sanitation into the home, had been shut down. And so along with all of that, and the mayor is constantly threatening, he's threatened a number of times, and as soon as the crisis, the declaration is lifted, the water shutoffs will go back to being and put in place. Although they have not stopped, people are still getting shut off in real time, and water has not been restored. Thank you.
Yeah, thank you so much for that, Reverend Rosalind. And alongside the water shutoff piece, you also talked about, you know, people being essential workers. So I will pass it off to you, Rachel, to speak about like something we've talked about in a previous conversation, how sometimes these essential workers are working multiple jobs just to make ends meet. So can you speak more about that, especially as it pertains to the Black immigrant community?
Yeah, and I will add to what, before I talk about that, I will add to what Reverend Roslyn was talking about with the water. I actually grew up in a country where water was very scarce. So we didn't have water a lot, but what we relied on was the river. Like, we lived by the Caribbean Sea, so you can go to the river, you can wash your clothes, you can take a shower. But thinking about the geography in the US, that's not possible. So I just thinking about the idea of not having water, it is like, what do you do, you know? So that was very powerful for me, Reverend Roslyn. So thank you for sharing that. But speaking of Multiple jobs. Yes, multiple jobs, I think, is something that's very common in most low-income communities, but particularly with Black immigrants. And the reason for that is one, the cost of living is extremely high in the Northeast, as I mentioned before. But two, you're typically supporting your family back home. I can tell you right now, as a child growing up, twice a year, I got a barrel from my family with food, clothes, water, every single thing I could possibly need, because my grandmother knew that we couldn't afford it. So, but that costs money. There's thousands of dollars you put down just to ship that actual barrel full of equipment, but just to fill it itself. So you may have one job, living in New York City, paying your rent, that's well over $1,000, but you also have a second job just to support your family. And what that does is it creates an issue where there's no way for you to really isolate. And when I say isolate, I meant in terms of your job. So, for most people, you're home, you go to work, you come back. Those are your limited interactions. Now, at my mom's job, my mother works at a nursing home. The issue is a majority of the people who she worked with, nursing aides, medical assistants, most of them are Black immigrants who have two jobs, as I mentioned. So most of them work at, let's say, a hospital or a cafeteria, and then they come to the nursing home. So the virus may not necessarily be within these facilities itself, but we have people who are coming from multiple jobs from all over, and they're coming to work. And when my mom as a nurse broached this subject to the supervisors, they were told maybe they can shower in between. Yeah. Well, let's say you're working 3 to 11 and you have an 11 to 7 shift. Where are you showering in between? There's no showering in between. And not just that, we think about how the virus attacks your body. It has to do with rest. You need to be able to rest your body for you to be able to recover. If you're working multiple jobs, that's not possible. I'm not sure if anyone on this panel has worked multiple jobs. I myself have. It's extremely exhausting. It's extremely stressful. And even when you are home, on your day off, you're not resting. Your body's constantly, you're wired and you're working nonstop. So, we talk about multiple jobs. Most of that has to do with income. Why is it that people work in multiple jobs? Well, minimum wage in the state of New Jersey is $10 an hour. For you to get a decent apartment, 2-bedroom apartment, is about $1,500 a month. And that's not including utilities and food and all the other expenses. You need to work 2 jobs, unfortunately, unless you have a position, a job where you're able to make sufficient amount of money that you can cover, your bills of one expenses, pay for your family, support your family back home, pay for your children, pay for your mortgage, all these things. Having 2 jobs is the only way for you to survive. And with the COVID-19 crisis, that comes into play. And let's say you work in New York City, you're back and forth in the subway, you're putting yourself at risk because you're going back and forth between your jobs. Your immune system is down because you're tired, you're not working. You're working nonstop, and then you're constantly in this place of jostling. And when you do come home from your day off, you're bringing those viruses and all those germs from those 2 jobs into your household, right? And like I mentioned, there's multiple generations. If you think about multiple generations in a family, if everyone has 2 jobs, how many touch points or what is the chance of you having this virus? It's a lot higher versus, let's say, you only have 1 position, or maybe you don't have as many people in your house. So with the COVID-19 crisis, it basically is putting you at bigger risk because you are around more. You're touching more things. You're at the laundromat, you're at the cash in place. You're at your first job, your second job, maybe even your third job. There's just too many options and ways in which you can catch this virus. And I think a lot of that, the issues that comes with having multiple jobs has just, as I mentioned before, really been exacerbated by the fact that you need to have space, you need to have distance, but that's not possible if you're living a life of poverty, where you're working multiple jobs and you're living in very close quarters.
Yeah, thank you so much for that, Rachel. And then you have the added issue of working multiple jobs, and a lot of these jobs aren't being given the proper PPE that they need. So personal protection equipment. If the doctors and the nurses aren't getting the PPE, then we know that the people who are cleaning the rooms aren't getting it. The people who are cooking aren't getting it. So there's so many layers to this issue, and I really appreciate you, Rachel, and you, Reverend Roslyn, for really laying setting the scene and painting a picture of what is going on the ground, because the things that you are talking about, that's not stuff that we are necessarily seeing in the articles, and that those aren't things that are being captured by statistics, but these firsthand accounts are really, really necessary in helping people to understand the insidious nature of racism, first of all, and to help people understand what is really going on. So now that we have kind of talked a bit about this large issue, let's turn to kind of talking about what can we do. So, you know, there are many Presbyterians across the country who are concerned and want to help, but, you know, what can we do as the Presbyterian Church, and what can our concerned members do in terms of immediate relief and long-term sustainable change? Because, you know, as we've mentioned all throughout this conversation, that the issues that we are seeing right now are not just coming up because of COVID-19. These are historic issues that have been happening. So, you know, people need immediate relief right now, but we also need long-term change so that when this issue is over, we don't come back to the same spot when the next crisis comes. I'll pass it over to you first, Rachel.
Okay. So I think Christian, you said long-term change or short-term change?
Both short-term and long-term.
Okay. So I think in terms of short-term, what I'm really seeing, at least in the community where I live right now, is that we definitely need more PPE. We have an issue where a lot of people are reusing their masks and reusing their gloves. And it's not because, they're not aware that they're supposed to have fresh ones, is that they cannot afford it. And I'm going to give you an example. So I went to the store very recently, an ethnic store where a lot of Black immigrants like myself frequent, because that's where you can find the food that, we eat. And the aisles were very narrow, and they were selling the masks. They were selling 20 masks for $30. Now, $30, if you have a good paying job, is not a lot of money. When you are making $7.25 an hour, that's a lot of money. You're paying for bus fare, you're paying for apartment. That is a lot of money. So we have families who have to go out, like I mentioned, to work their multiple jobs. Can they afford to change gloves and masks every time that they get on a bus, or they change at the subway, or they get on a new transfer? No, they can't. When we have children who are being sent to the laundromat to do laundry, you give your daughter and your son one mask and you tell them to, hey, come back home and wash this. But that's not what the CDC guidelines are. So I think definitely providing communities with PPE is something that can help to, one, reduce transmission, but also thinking long term, we need to start cleaning up these communities. These communities are polluted. They're dirty. If you go to communities like East Flatbush in Brooklyn, if you go to the Bronx, there are feces from the animals on the sidewalks. It's very prevalent. Homeless people, people who are not able to find a bathroom anymore because we've closed the McDonald's, or we've closed the place where people typically use the restroom. They're defecating and they're using the bathroom on the street. Again, not because there's something, inherently wrong with them, but simply they have nowhere else to go. So cleaning up these communities, thinking about like the bodegas, we think about the African stores, all of these are very cramped. Now, I am going to take a wild guess here and think to myself, I don't think that the average bodega owner can afford to bring in the deep cleaning specialist to clean his entire facility. It's typically going to be him and his staff wearing gloves and hats, and they're going to be doing the cleaning. So having, support systems to help people, one, protect their customers, but also to protect their businesses and themselves. Because at the end of the day, when we think about how people make their money, a lot of these small businesses, we talk about small businesses as being, 50 plus employees. But what about the African braiding stores? What about the bodegas? What about the mercados and the tiendas and all these small shops that are the crux of our communities, where we go to find food and we go to find the things that we're looking for? We need to be able to protect these communities the same way we're able to protect these big businesses who can't afford to bring in, specialists to come and clean their facilities. Another thing too, labor rights. Labor rights is a huge issue. We have people who are, withholding PPEs because they want to give it to the physicians. Well, the person who cleans the room needs the PPE just as much as the person who cares for the patients. You're not going to be able to care for the patients if the room is filthy. You cannot, the security guards who are guarding these hospitals and preventing riots and people from coming over, they need that PPE too. So having labor rights, not just in terms of having, workers' protections or protecting them from the virus, but also making sure that they have the proper time off. So if you are catching the virus, or if you are feeling sick, you should not be told to come into work, which happens a lot. And the issue is that Black immigrants do not know their rights. They are not aware that they do not have to go to work. For them, they're thinking about the money. I have rent to pay. I need to go to work. I'm going to drink some hot tea and I'm going to go to work, but I'm going to be coughing in between. I have a fever. I have a runny nose, but you're basically working while you're sick because, one, you have no choice, because typically these are not paid time. You don't have paid time off. And even if you are eligible for paid time off, you don't even know how to advocate for that. You know, you don't even know that you can read the HR manual and read what your rights are, because that's one, if you speak English, but two, there's a literacy issue. Many people, when they come to the United States, they aren't coming with an advanced college degree. They're coming with maybe a high school degree from a third world country. And, you know, that really limits your ability to understand what your rights are. You know, the average immigrant isn't going to spend the time going through the federal government websites to understand, you know, labor protection rights and what they're eligible for, because I will tell you, as immigrants, we have this mindset of let's put our heads down and stay out of trouble. Let's not rock the boat, because when you rock the boat, you tend to get in trouble in terms of, you know, we think about like immigration policies. Oh, if you have an immigrant who's causing too much issues, you know, immigrants have a fear of being deported. You know, not because they're committing crimes, but it's simply because it's in the back of our minds. It's something that we see a lot, especially with the ICE agents going into communities and raiding them. It's actually a fear of a lot of immigrants. So why would you rock the boat? Why would you push back against your supervisor who isn't giving you the proper PTE and paid time off that you have? Really and truly, you know, what we need I guess I would say in terms of long term is just advocating for people and educating them on ways in which they can continue to advocate for themselves, regardless of what position they are in. Whether you're a nurse, you're a janitor, you're a security guard, you work at Walmart, you deserve the right to be protected, especially when we have viruses like COVID-19 that essentially is decimating your communities and putting your health at risk and your families at risk too.
Thank you so much for that, Rachel. And I really want to lift up what you said in terms of immigrants not always knowing their rights. And we know that supervisors take advantage of that. They know that immigrants don't know their rights, or they know that they don't want to rock the boat. So they take advantage of that. So that that advocacy and that education piece is very, very important. So thank you so much for lifting that up. And we have about 10 minutes left. So Reverend Roslyn, I will throw the same question over to you. What is it that Presbyterians can do to help both in the short term and for long-term sustainable change?
Thank you. So yeah, let me go back with and just Rachel laid out an excellent plan. I need to say that. And so what all I heard was policy. We need to do some policy work, right? And it begins with advocacy, right? And so right at this moment now, we know that we need to be advocating and we've always been advocating and should continue advocating for one fair wage, right? Because as you pointed out, $10 an hour is not, and that's about what it is here, same here in Michigan, it's not going to pay rent anywhere, especially a place where people will be able to live comfortably, right? And the family will be safe. So it's that advocating and shifting of policy for one fair wage, also for earned paid sick time, because we know that at the onset of this, our folks could not get to the doctor when they were sick. We know that long before March 9th, when the governor declared a moratorium here in Michigan and in the other states, that back in January, we saw in our communities folks getting sick and with unknown illnesses, which always led back to this, it looks like, but could not take the time off. We did not have earned paid sick time. Calling into work was not an option. Having to take our children and carry them to the daycare or carry them to neighbor's house who were still sick. But also in Michigan and further out and all nationally, is the policy work. We've got to shift policy. We've got to push and address the policies that are in place, because that's where the long-term change is going to come from. And so even in Michigan right now, I would ask that the Presbyterians here in Michigan and all the listening audience in this on Facebook Live, call the governor, call the mayor's office, address the fact that the water shutoffs are still going on, that water has not been restored, and that water is still being interrupted. I have a stack of bills on my desk now. Like I said, the Brightmoor Connection has been raising money to pay water bills, to pay for water restoration. And what I'm seeing on the bills is that the bills are dated in April, right? Long after states have been closed down. So clearly that tells me that the policy is not being addressed of a moratorium. So we need to push for policy. We need to address the fact that no one should have to be forced to live without water. Water is a human right. And whether that water is in the home, the lack of water in the home, or whether we're seeing it just by virtue of the fact that our families can't get to laundromats, that they had the problem of just having to be able to get somebody on the line. We see federal funding coming in community, local funding coming in community, But as always, the perimeters are extremely high. There are too many obstacles. I have an application on my desk right now that thaw, the heating and warmth fund here in Michigan, right? Has money set aside just for water relief, to turn water on, for gas and lights. But it's an 8-page application during the pandemic. That's what we see. Knowing that our families, the libraries are closed. Most families don't have the accessibility to get online, that we have to use our phones, and our Wi-Fi is not the strongest. But not only that, once again, it's that attack on the intelligence of people. It's the criminalization of our families, right? We see that often, far too often, that the reason why, just as Rachel said, that if people complain, immigrants complain, is because they don't want to work and they're afraid that they're having to be sent back. And so it's always this criminalization, whether we're going to try to get the resources that's been made available, or whether the resources are gate kept. You see so much gatekeeping going on. We can't even get access to it because of the hurdles of having to fill out 8 pages, or having to upload documentation, or having to justify why we don't have water on, what we did with the money, the little money that we have, because Lord knows it's not enough to pay all of the utility costs and the rent, and just to sustain the family. When we talk about sheltering in, most people cannot afford to purchase 2 weeks of worth of food and go home and stay. That's just not the norm. That's not a real life scenario for the families that I see in community every day. And that's just, I see the commercials, and I kind of get upset when I'm constantly seeing this, the little soundbite, we're all in this together. No, we're not. We're not all in this together. If we were all in this together, we would all have the same resources. We would all have running water in our homes. We would all be making earned paid sick time. We would all make livable wages. We would have good, clean housing available. We're not all in this together. We were never all in this together to begin with. So consequently, now that we find ourselves trying to manage through a pandemic, we're definitely not all in this together now, because we don't have the same access to the resources. There's been a gatekeeping of resources from day one. And so now what we're seeing is it playing out in real time. And it's the way it's showing up is in the deaths of Black and brown people, right? And poor people. And so what families can do right now, what the listener and all these can do right now, is to make phone calls, support your local communities in the form of, whether it's donations, whether it's supplying. On our Facebook, on our website, we have asked, and we continue to ask for face masks and for gloves, because we don't have all of that. So we've been taking donations for that, because we have volunteers. We have extravagant volunteers who show up showing extravagant love for community-based volunteers, helping their own community out who don't have the resources. I need to point out also the unjust system of the policing. Because here in Michigan, everybody's seen on the March on Lansing with the guns and with the Confederate flags and everything that's been going on. But in the city, what you haven't heard reports of is the over 800 tickets that have been passed out of $1,000 to Black community members just going to the gas station, going to the grocery store, not having a mask on. They can't afford masks, and there's no mask available. And then the mayor here saying that he's going to dispatch more police to do more ticketing in the community, but nothing's being done in the state capitol. Nothing's being done in the outer communities. And so we need to talk about that. We need to address that. We need to have those hard conversations, because that's the only way we're going to get policy shifted, is when we're willing to have hard conversations and address, the truths, the little truths and the big truths, right? Because that's what we're seeing. That's what's playing out. But then also, like I said, we need to address the fact that the resources are not available. So we need to challenge that. Here in Michigan, over $8 million was given to one organization here that supposed to handle the federal funds, and they still haven't gotten up and running. And once again, even in getting those funds, there's a gatekeeping. There's a long list of obstacles that's in the way, and of course, it's the criminalization of those who are most in need, right? So it's that thing of, well, you need to prove why you need it. You need to show Social Security cards and show income for everybody in the home, and all of these obstacles that is so hard. And so what happens is our families are become afraid. If your water's shut off, they're gonna take your kids here in Michigan. That's a given. And while that may not seem like it's a real threat to someone who has their children in the home, and we're seeing commercials where everybody's painting on the sidewalks and they're drawing chalk, people are not able to do that when you don't have water. and when you're afraid that your children are going to be taken. So we need to go first to the policies. The policies are where we should start with always. But in the midst of it, we need to triage, right? We need to stop the bleeding. And that's what the immediate water comes into play with raising funds for water restoration fees, and raising funds to be able to purchase pallets of water. In the 21st century, we have to carry water out and place it in people's car in one of the wealthiest countries in the world, where people do not have access to clean drinking water, where people can't wash clothes, where they can't cook, where they can't wash hands. And what we see is constantly happening. And this is not just in Michigan. This is a global issue. It's national, global. What did we think was going to happen when we didn't have access to clean running water? Yeah. Thank you.
We can't hear you, Christian.
Oh. Well, thank you so much to Rachel and Reverend Roslyn for jumping in here and giving us all of this good information. And I think that both of them have given us a call to action that is twofold. We need immediate relief. People need masks. People need gloves. We need enforcement on the water shutoffs, or the moratorium on water shutoffs in not just in Michigan, but throughout the United States. But we also need some long-term advocacy so that we can have sustainable change, because as was mentioned throughout this discussion, these are issues that have been here. They are here now. They're still going to be here once the pandemic is over. And we really need to change this, because as Reverend Roslyn said, if we are all in this together, then we really need to all be in this together. Mm-hmm. If my neighbor is bleeding, then I'm bleeding. Mm-hmm. If I'm bleeding, then my neighbor is bleeding. That is the mindset that we have to have if we are really going to change, and we're really trying to lift others up. I wish we could continue this conversation, but we have come up to an hour. So thank you so much, Rachel and Reverend Roslyn, for joining our conversation. We will continue our series, COVID at the Margins. Our next episode of COVID at the Margins will be May 18th. It will be hosted by the Presbyterian Church Self-Development of People, who will be specifically talking to our Asian brothers and sisters about the anti-Asian racism that has been going on since the pandemic started. So thank you again for coming and speaking on our webinar. And thank you, Reverend Hawkins, for that amazing biblical interpretation. And thank you to those who have tuned into our webinar.
Thank you for having me. Thank you so much for sharing.
Thank you. This was a pleasure. Thank you, Christian.
Wonderful job.
Thank you all. I enjoyed everybody.